Everyone compares dentures and implants on price. Almost nobody compares them on the one thing that slowly changes the shape of your face. Stay with me because that is the part that should actually decide this. Here is the real difference, and everything else in this video comes from it. A denture rests on top of your gums, and it comes out. An implant goes down into the bone, and it stays. That one difference is why they feel completely different, why you can eat different things, and why one of them lasts longer than the other. So when people ask me which is better, what they are really asking is which of those two lives is the right fit for them. And by the end of this, you will know. If you want to know which of these actually fits your mouth and your life, the link below requests a consultation at our Manalapan office. It takes about a minute, and there is no pressure. Now here is the part about dentures that most people are never told. Because a good denture can be a genuinely good choice. It can look great, it can bring your smile back, and it usually costs the least upfront. So for a lot of people, it is the right place to start. I am Dr. Spiros Karas, and I have worked as a general dentist here in New Jersey for over 30 years. So I have made a lot of dentures that made people very happy. But here is what people do not always hear. A denture sits on top of your gums, so it can move a little when you eat or when you talk, and it takes some getting used to. And there is a quieter thing happening underneath. Once a tooth is gone, the bone that used to hold it slowly begins to shrink because nothing is stimulating it anymore. So a denture that fit you perfectly in the beginning can start to feel loose after a year or two, and it usually needs to be relined or remade to fit the new shape of your gums. That is not a flaw in the denture. It is just what living without tooth roots does over time. Now, let us talk about what implants actually are, because this is where the difference really shows up. An implant is a small post that goes into the bone and takes the place of the root of the tooth. On top of that post goes a tooth, or a whole set of teeth. Because it is anchored in the bone, it feels a lot more like your own natural tooth. You can bite into an apple, you can enjoy a steak, it does not move when you talk, and it does not come out at night. For most people, that is the moment things change, when they realize they can simply eat again without thinking about it. So what is the honest catch? Because there always is one. Implants cost more upfront, they involve a minor surgery to place them, and not everyone is a candidate on the very first day. If you have been missing teeth for a long time, you may need a little groundwork first to rebuild the foundation. That is not a no. It is just the honest conversation you deserve to have before you start. Here is the point that should carry more weight in this decision than it usually does. Implants protect your jawbone and dentures do not. Your tooth roots are what keep the bone in your jaw alive and full, the same way that using a muscle keeps it from shrinking. When the root is gone, the body slowly reabsorbs that bone year after year, whether or not you are wearing a denture. That is the change that can make the lower part of the face start to look a little sunken over time, and it is one of the main reasons a denture keeps needing to be refit. A denture sits on top of the bone, but it does not stop the shrinking underneath. An implant, because it actually lives inside the bone, helps hold that bone in place. So this is not really about vanity, it is about protecting the structure of your face and your bite for the long run. Now here is the option that a lot of people are never told about, and it is my favorite thing to explain. It is not simply dentures or implants. There is a very good middle ground. We can place a small number of implants, sometimes just a few, and then snap a denture onto them. So instead of resting loose on your gums, the denture clicks onto those implants and stays put while you eat and while you laugh. It gives you a lot of the stability of implants, but it costs less. For many of my patients, that is the sweet spot, the honest answer that fits both their mouth and their budget. And almost none of them knew it existed before they sat down with me. So if you thought this was a simple choice between two things, it is really a choice between three. So how do you actually make this decision in a way that you will feel good about years from now? It really comes down to a handful of honest questions. First, how much would a little movement bother you? Because some people never notice it and some people cannot stand it. Second, what do you want to be able to eat? Because that alone points a lot of people toward implants. Third, what does your overall health look like? Since that affects healing and candidacy. And fourth, what are you genuinely comfortable investing? because the best plan is the one you can actually move forward with. There is no single right answer that fits everybody. There is a right answer for you, and it almost always becomes clear once you sit down with someone who does all three of these options and has no reason to push you toward just one. Here is the one honest warning I will leave you with, and then I will let you go. The longer you wait with missing teeth, the more of that jawbone you quietly lose. And that lost bone can slowly take your best options off the table because some treatments need enough healthy bone to anchor to. I am not telling you that to scare you or to rush you. I am telling you because a decision you make this year is very often simpler and less expensive than the exact same decision 2 years from now. So if any of this sounded like you, the kindest thing you can do for yourself is simply get the information. If you want to know which one of these actually fits your mouth, come in and let us take a look together. Every day we have patients just like you walking in unsure and walking out with a plan and their confidence back. Book your visit by calling our office or use the link in the description or the pinned comment. And if you are leaning toward implants, watch this one next. It is called I Wish I Knew This Before Getting Implants. It is the honest list of things my patients tell me they wish someone had explained before they started. And I will see you there.